Welcome to the All About Pigeons podcast, brought to you by the All About Pigeons nonprofit organization, which is dedicated to promoting education and promotion of the pigeon hobby. Every week, a listener requests to drive our conversations about all things pigeons.
Today
Join me,
special
Philip
episode
Fry,
all
as we
about
learn and share
pigeon,
stories
which
about
affects
these
everybody,
incredible
whether you're
birds
into
and this
racing
ancient
pigeons,
hobby.
rolling pigeons, pigeons as pet, whatever. If you got pigeons, this is something you want to hear about. We have with us Dr. Erica Herzog. She got her undergraduate medical degree from UNC Chapel Hill and is currently practicing as a pneumologist at Yale School of Medicine in New Haven, Connecticut. So, Erica, thanks so much for coming on and informing us on this pigeon lung situation.
Oh, well, thank you so much for asking me.
So for those who may not have heard about it, can you explain what pigeon lung is and how it affects the lungs?
Sure. So pigeon lung is a type of allergic reaction that develops in the lung. And what happens is people will breathe in something produced by their bird that gets kind of trapped in the lung. Your immune system recognizes it and tries to clear it, but can't. And as a result, patients start experiencing cough and shortness of breath that might let them know that they're having a problem.
Are those kind of the first onset of symptoms would be like you're saying shortness of breath and coughing?
In most patients, yes. Most of the time, it will be what we call subacute or chronic onset, where you might first notice that you're coughing and then might notice that you're short of breath when you're walking around or maybe exerting yourself. Very rarely, people might get very sick to the point where the first thing that they notice is that they think that they have pneumonia because they're so short of breath and feeling unwell. But that's a rarity. Most of the time, it's this chronic, slow developing cough and shortness of breath.
And if it goes untreated, how severe can it get? You said it could even feel like pneumonia.
Yes, well, so in the subacute chronic type, if it goes on for months to sometimes years, the lungs can start developing a scar, and that means that they're beginning to solidify. And so after a period of time, the lungs might get to the point where you can no longer breathe and you need a lung transplant.
You're saying it's almost like an allergic reaction. So is this something that develops from, you've just been around it for a really long time? Who's more at risk of developing? Someone who's around it a bunch, or is it, I've even heard some people say that, so let's say there's two pigeon fanciers, one of them gets it really bad and the other one doesn't, and it's a genetic. Could that be the case too, or is it just exposure?
It's probably somewhere between the two. So that's a really excellent question that you're asking. Unfortunately, we don't fully understand why some people will develop pigeon lung and some people won't, even though they have the same amount of pigeon exposure. That's made the medical community believe that there is a genetic component, meaning that there's something about a group of patients that they're more susceptible, either because of something intrinsic to their lung or something about their immune system. They just respond to the pigeons in such a way that they develop this type of reaction and this lung problem. And other people who don't have that genetic problem or that genetic change are not susceptible, but we don't know what those genes are. And so at this point, that's still a guess.
So going back to like talking about allergens, what is it inside? The dust, the air, is it coming from like the droppings? Is it that dust that comes off of the feathers? What is it that's getting in and irritating the lungs?
So that's not known. You've already mentioned a couple of things that are believed to be causing the pigeon lung. And I think the most we can say is that it may be different parts, or we call it antigen when you're having this type of allergic reaction. It might be a different antigen for some people. I think that there's pretty good evidence that there might be something in the droppings that causes this in some people. There might be something in the skin or the feathers that come off the birds that might be causing this reaction in some people. And there's also some evidence that substances that are in the blood of the pigeons or in the body fluids of the pigeons might also be contributing. So generally people will, because those things tend to accumulate in the cages, that might be a time when someone might be more susceptible to encountering those antigens because there'll be a higher concentration there.
That's interesting. So I've heard people say before too, because there's people who actually keep pigeons as pets. I have a pigeon as a pet in my house as well. and they'll say that, oh, these pigeons, they create so much dander, that dander is a real problem. And, they'll even throw the word pigeon lung out there. Is, this is, you got to keep them bathed all the time. And I guess you could also say it kind of goes back to a loft. If you have a lot of pigeons with not good ventilation, that's just going to be a big old dusty mess. Are there other birds that have this sort of like thing? Like, is there like a parrot lung?
Yes. So pigeon lung is a subset of a larger group of diseases called bird fancier's lung. And bird fancier's lung is a subset of an overall disease state called hypersensitivity pneumonitis. So that hypersensitivity pneumonitis is what your lung doctor will call it when your lung is having this type of allergic reaction to something. So some people have it to mold, some people will have it to, like farmers will have it to substances that they might breathe in their silo or in their barn. People who encounter and work with birds will have the same reaction occurring to the birds. So yes, there are people who have the same reaction happening from their parrot or from their cockatiel. One reason why we might hear more about pigeons is because more people have them as pets. But I don't think that it's known that one bird might be more likely to cause this situation than others.
However, you have the setup, good ventilation, bad ventilation. Would you say that people are in a really dry environment? Like I live out in Arizona, very, very dry. Are we more susceptible to it because it's more of a dust thing, or would it be the other side of it where people who have really humid environments, maybe it's more of a mold thing? Would you say that there's one side or the other be more susceptible to spreading it around?
I don't think that could be said. And I think people living in those environments might, for various reasons, be more or less exposed. I don't know that I don't think that it's known that the climate itself could be causing one group to be more susceptible than others. But, in hot environments, people might be more prone to be inside and you might be around your pigeons more. Or in a humid environment, you might be more likely, as you said, to have mold developing in with the pigeon dander and other things, and that could also be exacerbating. So I think that there's equal possibility for both. And I'm sorry I can't give you a yes or no answer.
So if someone is thinking that they might have this, maybe they feel like every time I go into my loft, I start coughing and stuff like this, and they might be thinking that they might have pigeon lung. Is it a pretty easy thing to figure out? Like, is it a pretty quick test that they can get done and know for sure?
It's not as easy as going and getting your blood drawn, but it should be diagnosable fairly easily. I think the first thing that would need to happen is somebody would need to go talk to their doctor and let them know that they're having this symptom of feeling more short of breath and having the cough, and that they're concerned that it could be related to their pigeon. Depending on what type of doctor you have, you may need then to be sent to a pulmonologist, which is a lung doctor. The lung doctor will do a physical examination, will do some testing to see how well the lungs are working, and then may do a chest x-ray and may do a CAT scan. A CAT scan is kind of a three-dimensional picture of the inside of your lung. Depending on what the CAT scan shows, sometimes you can make the diagnosis just by looking at the CAT scan. Other times it might be necessary to do what's called a bronchoscopy. And a bronchoscopy, everyone always asks what that is. And the best way of saying it's kind of like a colonoscopy of the lung, where doctor will put a little camera down inside your lung, take some samples, and within probably about a week, you could get a diagnosis that your lung has this type of allergic reaction going on. But there's no specific way from looking at the lung to say that it's definitely from the pigeons. And so your doctor might do a blood test to see if it's probably related to the pigeons. But generally, what we say is when there's evidence of this type of lung situation, like this allergic reaction, and somebody has a pigeon, then you'll make the diagnosis that the patient has pigeon lung, and then you need to start, helping the patient deal with it.
So let's say somebody does find out that they do have pigeon lung and that it is something that the more they're around it, it's causing issues. What is it just going to be? That's it. No more pigeons for you? Or what's some of the treatment options for healing on that?
Yeah. So the only known way to get the disease to go away in the early stage is to remove exposure to the antigen. The antigen, again, is the thing that you're breathing in that's making you sick. So the only way to truly rid your environment of the antigen is to get rid of the birds. But, that's many patients find that difficult, and I I can totally relate. I have a dog, and if I had to get rid of my dog because it was making me sick, I would really want to find a way to keep my dog and keep myself healthy. But the medical recommendation is always going to be to get rid of the birds. Now, for patients who want to keep the birds, there are certain things that people can try. And really keeping like cage cleaning, scrupulous cleaning, maybe having a different place where the birds are, so they're not with you all the time, wearing a mask when you're doing the cleaning, trying to limit the handling, that all of those things are proposed as being protective. The hope then is that if you're no longer breathing in these bird antigens, that if you're early enough in the disease, then the disease can subside and your lungs can go back to normal.
Is there any kind of medication that can just kind of calm down the irritation that's going on?
Yeah, so early in the disease, patients are often treated with what we call prednisone or glucocorticoids. This is a very, very strong medication in the steroid family. And depending on how severe the disease is, they might need the prednisone for a couple months. Typically, you might be treated for 1 to 2 months, and then we taper it off. Prednisone, I don't know if you or your listeners have heard of it, but prednisone, it's a really, really wonderful drug that can substantially reduce inflammation and allergic responses. But prednisone has a lot of side effects. It can make diabetes get worse. It can make people gain weight. It can make your bones weak. So we try to keep the prednisone for as short a time as possible in order to try to get the lungs back to how they were before.
Let's say you get diagnosed and you do have pigeon lung, and let's say you get on some of this to help the condition of your lungs physically, and let's say you wear a mask and you limit exposure to pigeons. Would you ever be able to get back to a state where, hey, your lungs look good, kind of go back to normal, or would you always have to, from that point on, always have to take precautions?
That's a really good question. It probably depends on how entrenched the immune response was. If it was a relatively mild or early stage, you could probably go back to normal. But as your body becomes more and more strongly reactive to pigeons, it can be that you go into a room with pigeons and you might feel the disease coming back on. So you really, as the disease becomes more entrenched in you, you have to really start taking precautions.
What kind of steps can somebody take who, say they're in good health as is right now, and let's say just routinely cleaning out the loft, or would you even recommend wearing a mask during, handling or being in the loft at all times? What kind of steps can somebody take to just kind of prepare themselves or protect themselves from pigeon lung?
Patients ask a lot about things that they can do to limit their exposure to things that are in their home. And so, because as I said, pigeon lung is a smaller subset of a larger group of diseases where somebody's responding to something in your environment. So I think the advice for pigeons is similar to the advice that we give for any type of antigen where there's something in your home or in your work environment that's making you sick. So the first thing is always remove the antigen or minimize the antigen. But there are other things that you can do. So wearing a mask while you're interacting with your pigeon may make that interaction less meaningful, but it could also help protect your lungs. And if you're a person who's susceptible, you may want to consider mask wearing, and probably a good mask. I think over the last few years, people have become much more knowledgeable of the strength of the different types of masks. And so the N95s that people were wearing a couple of years ago a mask with a really good fit, a mask that is able to filter out particles that could get through. That would be a type of mask that would help. I think the surgical masks that are very thin, that don't really have a good fit, I don't think that would be sufficient to keep these particles out of your lungs. Regular cleaning, keeping the cage clean. Obviously, when you're doing the cleaning, having protective mask, gloves, things like that, potentially doing all of that outside. Another thing that people will try is a HEPA filter or some type of filtration system in their home, or particularly in the room where the bird may be. Some people may choose to have a room where that's the only place that they interact with the bird. Again, I could see that might be difficult when you have a pet and you can only interact with them in one part of your home. But on the flip side, you want to be able to breathe, and you need to have your lungs for decades moving forward. So finding a balance between interacting with the bird and keeping your lungs healthy will be very important.
I see a lot of guys just throw a handkerchief up on their face. Is that really doing anything at all? Would you better off just not even doing the handkerchief?
I don't think I could say that one way or another, but the size of these particles are pretty small, and they can probably make it through or around a handkerchief over their face. So putting a mask that doesn't work on might give a false sense of security and might inadvertently or might might ironically sort of make things worse because you think you're protected, so you're less careful. Whereas if you weren't wearing that mask or that handkerchief, you might use a little more caution.
Like you said, we've all become a little bit more aware about the different kinds of masks out there. So you recommend like the K95s, something that fits your face really well. Do you think it'd be like from a K95 to some of those respirator setups? Because I've also seen guys use those where they have the replaceable charcoal canisters on there.
Well, yeah, I mean, those are very, very good masks, and those you definitely know that you have the correct fit and you have the correct. I wish that we were on video because I'm doing a lot of hand gestures of like the different masks, how they go on your face. Did I understand you correctly that people wear those respirators when they interact with their birds?
Yeah, I've seen a couple guys wearing them when they're cleaning
Oh,
out their loft specifically, just because that really stirs up a lot of dust.
I think that is a very good approach. Those masks theoretically should have that should be comparable to N95s, but the obviously those respirators, they're more durable. You get the better fit, the better seal. Also, you're not going through a mask every time that you use them. So those respirators would definitely be something that people should consider using.
Is there any other kind of advice that you would recommend for people when they are cleaning lofts or even just going in their lofts? Let's say, would it be even worth doing if you're only in there for a few minutes? Like, let's say you're just checking feed or banding some babies or something like that. If you're in there for just a few minutes, would you say even then throw one on or?
Yes. Yes, I think that for two reasons. First of all, the antigens get into your lung and they're not really able to be cleared by our immune system. And so even getting a little bit in over a period of time can get your immune system kind of primed and ready to respond. The other reason to wear the mask whenever you're doing the cleaning, and even if it's for a little short time, is just to get in the habit of prioritizing respiratory health when you're in there with the birds, and just kind of make it a habit that every time you're going to do something, you put on the mask, even if it's just for a minute or two, because that way you'll have very good hygiene as it relates to your lungs, and you'll be doing your best to keep them healthy.
And one of the things, I mean, like what I try to do with the house pigeon that we have is I let her take regular baths. I feel like that helps just keep the dander down overall. Like some of the pigeons that they're not getting a lot of baths, like they definitely seem to just kind of put off more dust. Would you say that would kind of help, just kind of letting them bathe more to keep the dander down on their body?
I don't know enough about pigeons to be able to comment on how that would interact with the dander. But I do think that keeping the birds and the cage clean, just overall, will likely be helpful, because even if it's not the dander, let's say it's something from the droppings, if the bird has droppings, or let's say it's from body fluids, if the bird has body fluids on, just washing those things off are likely to minimize the pigeon's ability to get you sick.
How common is pigeon lung? Is it a pretty common thing, or is it sort of a rare thing?
It's pretty rare. It's rare. It's probably more common in the bird fancier community, but in the general population, it's quite rare. Actually, it's so rare that most of the time when people go to the doctor with it, the doctor might miss the diagnosis the first one or two visits, because when patient comes in with shortness of breath and coughing, the first thing people always think of is asthma or COPD, which is, I don't know if you know what that is, but it's kind of smoking related lung disease. So it's usually unless you go to the doctor specifically and are saying, oh, I'm worried that, I have a bird and I'm coughing, I'm worried it might be from the pigeon. Most of the time the doctor will think of things that are common, which would be the asthma, the type family. And so it might take a little while before they think of it.
And you mentioned some of the different medications that are out right now to help heal the lungs from that. Is there anything like new coming up on the horizon to help treat pigeon lung, or is we pretty much got a solution that works already?
I wish we had more solutions that could permanently just make it go away and have people be able to have their pigeons, right? Because the drugs that we have right now, we have really two ways of treating pigeon lung with medications. The first is these steroid drugs I talked about. These are one of the oldest classes of drugs that we have, and it's how we've been treating this disease now for decades. Very recently, in the last 3 to 4 years, there's been a drug called nintedanib that has been approved to treat patients with advanced scarring in the lung from any reason, including pigeon lung. So this nintedanib drug, this is a drug for people with very, very severe pigeon lung where there's a lot of scarring. It doesn't make it get better. It doesn't reverse the disease. It just kind of prevents it from getting worse. So what we really need, and what I really hope somebody will be able to identify, is a way to fix the lung, suppress the immune system, and allow patients to continue to interact with their pets and love their birds. But we're not quite there yet.
And so if anybody wants to find out a little bit more and go in depth on learning more about the pigeon lung, is there any resources or websites that you could recommend to the listeners?
Yes. So I found a really great one. This was a website that I found that had a lot of really great information, and it was called enviroliteracy.org/how do you prevent bird fanciers' lungs. And it's really detailed.
I will share that link on our social medias too for people to check out when this episode comes out. We're coming up against the clock here, but I really want to thank you for coming on and talking with all of us pigeon guys and girls about pigeon lung and giving us some really good advice to kind of keep ourselves safe and what to do if something does come up. So thank you so much for coming on and talking with us. I really appreciate it.
Oh, you're welcome. And thank you for asking me. I really hope you all learned something and that I helped you and that you're able to be with your birds in a safe way.
Thanks for tuning in to another listener-requested episode of the All About Pigeons podcast. We truly appreciate your support. The soundtrack for the show comes from the pigeon musician Vital Mizrahi. If you have a topic or a guest you'd like to hear more about in future episodes, or if you yourself would like to be a guest and just talk pigeons, please don't hesitate to reach out to us through email at allaboutpigeonspodcast@gmail.com or join our Facebook page, All About Pigeons Podcast, and connect with us there. Don't forget to leave a 5-star review wherever you listen. It supports the pigeon hobby and really helps the show. Remember, together the hobby thrives, support each other, and enjoy your pigeons.